Welcome to Enduring Training for Directly Observed Therapy Workers. This is Lesson 5, Providing Directly Observed Therapy. The learning objectives for this lesson is to list strategies for providing directly observed therapy to adult patients. I wanted to start off with a quote from the Treatment of Tuberculosis, American Thoracic Society, Centers for Disease Control and Prevention, and Infectious Disease Society of America, 2003. Any public health program or private provider or both undertaking to treat a patient with tuberculosis is assuming a public health function that includes not only prescribing an appropriate regimen, but also ensuring adherence to the regimen until treatment is completed. This is accomplished through the use of directly observed therapy. DOT ensures that the patient is given the accurate amount of medications taken. It allows the healthcare worker to monitor the patient regularly for side effects, solve problems that might interrupt treatment, and is used to improve TB patients' completion rates. DOT also decreases time of infectiousness, reducing the isolation period. Persons not receiving therapy for TB disease are more likely to have a prolonged infectious period, feel sick longer, continue to expose others, have potential for developing drug resistance disease, and possibly die due to interruptions in treatment or failure to detect adverse reactions soon enough. It is the responsibility of the DOT worker to verify the prescribed medications prior to administration of any medications. We must inquire about potential side effects and immediately report any concerns to the nurse case manager prior to administration of medications. We deliver the medications and observe the patient swallowing all prescribed medications. Then immediately document the visit, being sure to notate anything of significance. In preparing for a clinic DOT visit, be sure to have all of your supplies, which include the DOT log or toxicity sheet, the prescribed medications, a drink, a snack if necessary, your tools like a pill crusher, pill cutter, or a medication cup, and be sure to have access to a private area. In preparing for a DOT field visit, it is helpful to have kind of a mobile unit. Have a file system similar to the one pictured here, where the patient log forms or any additional materials can be kept. You will need all of the same things you need in a clinic visit during the field visit. Some patients, pediatric or adults, may require crushing and mixing of medications. Be sure to communicate with them on a regular basis to be sure that they have whatever it is they need for mixing. It's helpful to carry a bottle of something with you just in case, like a bottle of jam that's pictured here or a bottle of chocolate. Something that's easy to transport. Here's a little video clip of a San Francisco TB DOT worker preparing for and making a few DOT visits.
When I come to work every day, the first thing I do is prepare the sandwiches in the kitchen. We bring sandwiches, different juices. We have crackers, we have lollipops, and instant noodle soup. Because some patients like different things. I feel that incentives really help. A lot of our patients are really economically poor. Most of them are on public assistance of some kind. And some of them are homeless and things like that. So, some of them don't even have any food to eat at all. So I think incentive like sandwiches and stuff like that is really helpful. Sandwiches.
Do we have to pick up sputum from anybody? No sputum
we don't have
today.
to pick
Okay,
up the sputum
so we don't need any sputum.
On a typical day, we see about 16, 17 patients. Normally I'm out on the field about 5-6 hours. I always travel with a partner for the safety reasons. DOT is good because these patients need help. We're dealing with a lot of patients in a high-risk categories. Some of them are not really reliable. A lot of them forget to take the medications. We make sure that someone's there to watch them take it. Now we're going to see about 40-year-old female patient. She's a drug abuser, and she's an alcohol abuser, and she's a homeless patient. She's, it's a little facing a little bit of mental health problems. She keeps forgetting things. Right?
Hi.
Nice and shy. How are you, Teresa? We're there basically to not only watching them taking the meds, but to help them, to assure them that we're there, we care. Having a good rapport with the patients are very important because, you're going to have to establish some kind of relationship, some kind of trust between the workers and the patients. Well, we got you. That help them comply with taking the meds.
It's a challenge, really, to deal day in, day out with some of these patients. We're talking at least 6 months of taking pills almost every day. And you combine that with patient factors like some persons who are homeless, persons who are using substances, persons who have mental problems. Just to give you an example, there are those other barriers. What really works is the tender, loving care that the staff give to the patients.
If they ask you a question, for instance, they'll say, gee, how long am I going to keep taking these medicines? And if you don't know, just say, I don't know, and I will find out from the nurse, and then follow up.
We've gone and recruited staff from the communities of the patients that we serve. So we can identify with our patients. All the incentives, enablers, they help. But it's this caring, respectful attitude towards your patients. This needs to come across.
Sometimes some questions come up. Why do you need to watch me taking medication? You guys don't trust me? Our answers to that question is not that we don't trust you. We are there to help you. Now we are going to see the 14-month-old baby who has TB on the neck. This baby is on DOT because his family have childcare problems. We didn't know how we're going to give the meds to the baby. The mother suggested that we should mix the medicine with the juice and suck it up in the syringe. All it takes is just a few seconds, and then he's done. Just a second. My favorite part of doing DOT is to get to know the patients. I like it best when the patients are happy. I like the way they smile, the way they greet you, they greet me. If they see you are happy doing it, they will feel happy. They volunteer the information, talk about their family problems, talk about the fun things in the family, things like that. It makes me happy, just make my day on that day.
The DOT log or toxicity sheet, however it's referred to in your clinic, should contain some minimal information. Information on the patient like their name, date of birth, their current address, their language, and their weight. Information on the orders like the prescribing doctor, the dose, the regimen, and the date the medication was prescribed. And it should have an area for questioning regarding side effects. Here's a sample DOT log from the Houston Department of Health in Texas. Be sure to document any significant event in a professional manner using abbreviations that are appropriate and understood by anyone who may read your note. Include the date of the note and the initials or the name of whomever wrote the note. The documentation should include factual occurrences and not opinions, and should follow the who, what, when, where, and why format. Here's a sample of a good progress note and a bad one for reference. Can you see the difference in the two notes? One has the date and name of the person who wrote the note. The information is factual, detailed, and professionally written. The other uses unprofessional language and noted side effects but didn't include what those effects were. During your first visit with the patient, plan to spend at least 45 minutes but up to an hour with them. Be sure that you let them know when scheduling this visit that it's going to be a lengthy visit. During this visit, you should introduce yourself. Not just your name, but your role, how long you've been working for the program, and any other relevant information that can help in building a rapport with your patient. Allow the patient to introduce themselves as well. Provide them with additional names of those who may be involved in their care. And most importantly, during this visit, provide them with education. Provide them with your contact information, your office phone number, and your cell phone number, if your cell phone is provided by the clinic. Do not share your personal information like your personal cell phone number with the patient. Be sure to verify the patient's number and ask if there are any additional numbers that the patient can be reached at. If they provide you with a cell phone number, ask them if they're able to accept text messages. Do they have any email addresses? Be sure to provide them with a business card for both the nurse who's managing their care and for the clinic supervisor. Providing an overview of TB, discuss with them what TB is. What are symptoms of TB? How do people get TB? How is TB treated? What is TB infection versus TB disease? Be sure to provide information that's tailored to the patient's literacy and health literacy level, and provide information that is culturally appropriate. The nurse case manager can provide you with information to provide to the patient. Be sure to check in often with them to see what questions they may have. And if you don't know the answer, be sure to let them know that you don't know, but that you will ask the nurse and get back to them with an answer for the following visit. Be sure to review the prescription with the patient. Show them the medications, identify any markings, and provide the strengths that the medication is supplied in. Count the number of pills and the dosage. This was a common way for patients to verify the medications. They knew that they had 2 red ones or 3 big white ones, etc. When providing education on side effects of the medications, it's important to stay away from medical terms like peripheral neuropathy, malaise, jaundice, and use more acceptable explanations like tingling in your fingers and toes as if stepping on push pins, or feeling tired, having a yellow tint of the skin or the eyes. I found pictures to be very helpful for me. Create handouts with images like these to help describe what you're looking for. Pictures have the ability to communicate at every level. This is also especially helpful when working with patients who don't speak English. I would have them translated on the back of the images, so I had a card with the pictures, and behind the picture, I had translated into the language that the patient spoke what it is that I wanted to ask. I did this with the use of an interpreter, of course. I would show the pictures to the patient, and they will either nod yes or no. And that's how I did the tox checks with the patients. Explain to the patient that as long as labs remain positive, they should stay home. Not invite anyone into the home, and wear a surgical mask. You should be wearing an N95 mask while providing DOT to the patient while infectious. Discuss the difference between an N95 and a surgical mask and why you wear the N95 and they wear the surgical mask. Some patients take this very seriously and want to do more. You can suggest that they can open curtains and windows. If the weather is good, they can put a boxed fan in the window and face it backwards so that the air is being taken out of the room. And you can encourage them to practice good cough etiquette. The patient should be wearing a surgical mask. This mask reduces the amount of droplet nuclei expelled into the air by an infectious patient who talks, coughs, sings, etc. This is more comfortable for the patient, is inexpensive, and disposable. The N95 should be worn by the healthcare worker and prevents droplet nuclei from being inhaled. It is specifically fitted to fit the wearer and is not really that comfortable. When wearing the N95, you have to really project so that you can be heard. It is necessary to explain DOT to the patient because DOT is not used for any other disease. Most people, when they hear DOT for the first time, are quick to be defensive. I've always commented on how great this is for them. I'm so enthusiastic about DOT that sometimes people don't know what to make of me. I tell them how great it is and that I wish other diseases would adopt this. And I'll tell them, like, I mean, really, how great is it that you have someone bringing you your medication and that person is going to check in on you to make sure that the medication is doing what it should be doing and not causing any adverse reactions? How great for you that you have someone taking care of making sure that your medications are always available. No need to remember about refilling or medications being out or even paying for the pills, which are super expensive. How great that you have someone to talk to about this. And yes, I really would talk to them like that. Be sure that you explain the process to them. Let them know what they can expect from your visit, how long the visit will take, what will happen at each visit, and etc. Explain that the TB bug is strong, and in order to kill it, it takes a long time. Explain to them that successful treatment is based on the number of doses taken by DOT, and that any missed doses prolong their treatment. Here is part 1 of a video entitled An Introduction to DOT Fieldwork by Public Resource Organization. This isn't really a series, I just broke it up into a few clips. These are clearly actors, and this one in particular has the worst fake accent, but the information is good, so here it is.
Excuse me, hi, I'm Michelle Vega. I'm from the County Health Department. I'm here to see a patient of yours by the name of Alexander Volkov.
Sure. Mr. Volkov is in room 315. That's right down the hall and on your left-hand side.
Great, thank you.
Sure.
But Dr. Rogers, I am a very busy man. I don't know if I will be able to remember to do all of these things that I must do all by myself.
Well, that's why I've asked somebody from the County Health Department to stop by this afternoon.
Hello, how's my timing?
Couldn't be better. Alexander Volkov, I'd like you to meet Michelle Vega.
Hello, it's a pleasure to meet you, Mr. Volkov.
Oh, please call me Alex.
All right, Alex.
Alex, Michelle stopped by today to talk to you about directly observed therapy. That's designed to help you take your medicine over the next 6 months.
Okay.
Well, Alex, I am going to finish preparing your discharge papers while Michelle explains what directly observed therapy is. Good to see you again, Michelle.
It's great to see you too. Bye-bye. Well, Alex, you must be very excited about going home today.
Oh, very much so. I need to get back to work if I want to be able to keep my job.
Oh, and where's that?
I work at the baggage in the airport.
Oh, I imagine there's quite a bit of heavy lifting involved.
Yes, there is. It is important to stay healthy.
Well, as long as you take your medication, you should be fine. And that's why I'm here.
To help me with my medication.
Yeah, sort of. It's like Dr. Rogers said. I'm from the County Health Department. I'm what's called a DOT worker. DOT stands for Directly Observed Therapy. And I'm here to make sure that you get through your treatment from start to finish.
Oh, so what is this therapy?
DOT means that I'll be responsible for watching you take your medication.
So you mean I am like a child and cannot be trusted?
Oh no, of course not. I can't tell you how important it is, Alex, that you take all of your medications at the right time. You're going to be taking several medications all at the same time during the course of the treatment for your TB. Anyone, including myself, would have a difficult time remembering which medication to take at the right time over a 6-month period. We do DOT treatment with all of our patients.
Continue.
I'm not only here to help you take your medication, I'm also here to make sure that the medicine is working the way that it's supposed to, along with checking to see that you don't have any bad reactions along the way. I'm also here to answer any questions that you might have about the medicine.
And this continues for 6 months?
I'll need to see you 5 times a week for the next 2 weeks. and you'll have to take your medication on your own over the weekend. If everything goes well, we'll meet 2 or 3 times a week after that, per Dr. Rogers' decision. Did Dr. Rogers tell you about going to the clinic once a month?
Yes.
Great. Any other questions?
So, you are like coach.
Exactly.
Okay. So what do we do next?
Well, we need to find a time and place where we can meet 5 times a week.
You are welcome to come to my apartment if you like.
Thank you. Why don't you tell me your address?
I live at 78 Dean Street, apartment number 1.
Great. Now all we need to do is find a time. You said that you worked at the airport. What shift do you work?
I work a second shift, 4 p.m. till midnight.
Okay, how about a morning meeting then?
Okay, not too early. I sometimes like to sleep in.
How's 11 a.m. sound?
Okay.
Perfect. Well, since you're being discharged today, I will see you at 11 a.m. sharp. It was a pleasure meeting you, Alex.
Okay.
Wow, I haven't been to this part of town in a long time. But since I checked out the city map, I know exactly where I'm going. Let's see, I'm still a few minutes away. Just enough time to check out the neighborhood. This area looks wide open. Not too many trees or shrubs for hiding places. A decent amount of visible space. Several exits to and from the street. Not too many people around. All right, Michelle. You're dressed comfortably but appropriately. No chains, no dangling earrings or high-heeled shoes. You made sure to put just a few dollars in your wallet instead of your purse. And you have county ID. Check.
Yes?
Good morning, Alex. It's Michelle Vega.
It's 11 o'clock already.
11 o'clock on the nose.
In that case, please, come in.
Thank you.
Can I offer you a cup of coffee?
Oh, no, thank you. I've already had 2 cups this morning.
Okay, very good. Well, let's go in kitchen.
Sure. So how did you sleep last night, Alex?
Oh, I sleep like log. My bed is much more comfortable than a hospital bed.
Oh, I'm sure it is. Alex, could you please get your medication?
Here it is.
You'll be taking these 4 drugs every day for the next 2 weeks. So all we need now is a glass of water.
Sure. For this, I think I need big glass of water.
So did Dr. Rogers go over the medication with you?
Yes, but the names were very confusing. ISO something, Rifa, I don't know. All I know is I take 4 drugs, yes?
Yes, that's right. And let me help you with those names again. But you were right on track. Isoniazid, rifampin, pyrazinamide, and ethambutol.
Okay, very good.
Now, while you're taking these drugs, it's very important that you let me know if you begin having any bad reactions.
Like what?
Well, for example, if you begin to have no appetite, or you begin feeling very tired or very weak, or you begin to have an upset stomach, or you see any rashes, or if you see any bruising, or the whites of your eyes or your skin begins to turn yellow, you need to stop taking the medication immediately.
Okay.
Hold on, there are a few less serious side effects that won't stop you from taking the medication, but we'd like to know if any of these happen. If you have any muscle or joint aches, I'd like it if you could let me know, okay?
Sounds like cure is worse than disease, no?
The rifampin will cause body fluids to turn an orange color, and your tears and your urine will start to look a little different. But that's normal. But those other things that I mentioned, they only happen if you're having a bad reaction to the medication. And this is something we need to monitor, okay?
Okay. But this paper you're taking out?
Oh, well, this is my medication log. It helps me keep track of how much medication you've swallowed and when.
Like calendar, no?
Oh, yes, it is like a calendar. As I said before, you'll be taking these pills every day for the next 2 weeks. And if everything goes well, 2 to 3 times a week after that, per doctor's decision. And your trip to the clinic, once a month, right?
Mm-hmm.
So how do you plan on getting there?
Oh, I take a bus, maybe Ren will drive me. I don't know, I figure something out.
What about this? When it's your time to visit the clinic, I'll give you tokens for the bus. And I'll give you a coupon for the diner across the street from the clinic. They make the best cup of coffee there, and you wouldn't believe the apple pie. Deal?
It's deal.
At the first visit, you may find that the patient has already taken their medication. The patient may have been given a few days' worth of meds upon discharge or given a prescription from the hospital. The patient's primary care physician may also have written a prescription that was filled. If the patient has taken their dosage of meds for the day, do not give them another dose. DOT provisions cannot be initiated for another 24 hours, so the appointment will need to be rescheduled. Notate this on the patient's record and continue with the introductions and the education. If the patient took biweekly or triweekly meds that day, DOT cannot be initiated for 48 hours. Self-meds should be picked up and returned to the office after an explanation is given to the patient. Just a reminder to be aware of patients who try to cheat or hide their pills under their tongue, keep pills in hands, hide them in furniture, promise to take them later. Watch for them to pick up an object like a phone or hide them when they pick up their child. If you have strong suspicion that a patient isn't swallowing their medications, consider asking the patient to open his or her mouth. According to the CDC Self-Study Modules on Tuberculosis Module 9, individuals have the right to ignore a doctor's advice or refuse treatment if they wish. However, persons with infectious TB may lose the right and if health officials believe these persons risk infecting others by not taking their prescribed medicine. Patients who are unwilling or unable to adhere to treatment may be required to do so by law, or may be quarantined or isolated until non-infectious. What is quarantine? Quarantine is the involuntary confinement or isolation for inpatient treatment. To quarantine a patient usually involves a court order and should be the last resort. TB programs should not begin proceedings for confining patients to a treatment facility until after the patient has shown that he or she is unable or unwilling to follow treatment. Quarantine is different from isolation in that it is a type of forced isolation. Criteria to quarantine someone include lab results, clinical signs of infectiousness, abnormal chest x-ray with visible cavities, history of non-adherence, opportunity to affect others. Remember, anyone can refuse treatment for TB, but they cannot be contagious and around others posing a public health risk. DOT can be a tough sell, especially if the person is being treated for TB infection via DOT. Anyone can forget or neglect to take their medications. DOT can imply that the patient is incapable or irresponsible. It can be received as demeaning or punitive. It can be insulting to some people. It can be disruptive to the patient's life. But it is important to remind the patient, first off, how awesome it is. And it's important to believe that yourself. If you show any indecision yourself, you'll lose them forever. So you have to believe in the DOT process. Here is part 2 of the video clip from the Public Resource Organization.
Mr. Allen, I'm Michelle Vega from the County Health Department.
Hey.
I'm here to talk to you about your tuberculosis skin test, what it means and how you'll need to be treated.
Okay, I guess. This guy, Jerry, lives at the shelter that I do, and told me that he got TB. Now we have to all come and get checked for it. They told me that since I live in the same place that I got to come here and get some tests. That's why you're here, right? To tell me I got TB?
Well, you don't have what's called active TB, but your tuberculosis skin test shows that you have been infected with a germ that causes TB. You became infected when you were exposed to someone who has active TB. So what you have right now is the infection, and not active TB.
Well, if I'm infected, then I got it, right?
Not exactly. A person can be infected with a bacteria that causes tuberculosis disease, but not have active tuberculosis. A lot of people are infected with the germ that causes tuberculosis. And then some of those people do go on to develop active tuberculosis. What you have is the infection, not active tuberculosis. Do you see the difference?
Yeah. So what you're saying is I don't have TB. Good. So I can leave. It's Tuesday. They always serve beef barley soup on Tuesday, and I like beef barley soup.
Wait, Mr. Allen, before you go, just another minute, okay? Just because you aren't feeling the symptoms of the TB infection doesn't mean you're not infected. You are. And if you don't take the medication to get rid of the tuberculosis infection, you can get active tuberculosis.
Okay, well, give me the medicine I need to take, and I'll take it. Because it's Tuesday, beef barley soup. I gotta go.
Mr. Allen, treating TB infection takes a long time. You'll need to take medicine twice a week for 9 months.
Damn, woman, you crazy? 9 months? You just told me I don't have TB. Why I gotta take medicine for 9 months? Don't you see, I can't be taking medicine every week like that. I got a reputation. People think I'm sick. That could cause me serious problems. You should see what they do to Jerry. Nah, can't do that. Sorry.
No one needs to know that you're taking the medication, Mr. Allen. And it's very important that you take the medicine twice a week for 9 months and come to the clinic for regular checkups once a month. If you don't take the medication, the bacteria can remain in your lungs. And if that happens, you're in danger of getting active TB. And if that happens, everyone will know.
Well, they're gonna think that anyway if I'm taking pills.
Listen, I'm here to help you stay healthy. What if we make some sort of an arrangement to meet away from the shelter?
Like where?
There's a really pretty park a couple of blocks away from a shelter. There's a couple of picnic benches across from the pond. We could meet there. What do you say?
What time?
Let's say 10 a.m. You can take your medication and you can go back to the shelter and no one has to know.
So I don't have to keep any medicine on me, and you'll meet me at the park each time. Why would you do that?
Because it's part of my job. So what do you say?
Okay, let's give it a shot. As long as no one finds out.
Great. Tomorrow morning at 10 a.m. Now before you leave, I want to give you this pamphlet on TB infection. You can read it whenever you get the chance.
We cannot predict who will take their TB medications correctly. I have had patients who are on their way upper end of the tax bracket be the biggest pain in the butt, and I've had a drug dealer be among one of the best of my patients. You should notify your program manager, nurse case manager, or other designated point of contact person as soon as you suspect any issues. Determine why the patient is not willing to take medications, and begin strategies that will help the patient finish treatment before legal measurements are taken. Some potential social barriers to treatment are drug addiction, employment, and mental illness. If the patient uses illicit drugs, then the importance is placed on the drug use, and DOT may interfere with that. If the patient is willing, encourage them to seek treatment. If they decide to seek help, aid the treatment process by providing praise and encouragement for their decision. Employment is a barrier either because the patient has no time or the employment site is a challenge to coordinate. For example, a truck driver. Recruit other health departments to aid providing DOT. I give this example because we had this happen. We had a truck driver that carried his medications with him and met at an agreed upon location by a healthcare worker for DOT at each city. He just happened to do DOT with a different person every day, but he still did DOT and he still completed his treatment. For patients with mental health issues, and depending on the illness, a patient may feel like they are being poisoned. Maybe the patient has been off of their medications because they cannot afford their medications since they have not been able to work because of their infectiousness. Let the nurse case manager know so that she can work with the patient to secure medication. There are always additional barriers to discuss, and there is no way that they could all be listed since barriers are specific to the patient and every patient is different. Just be sure that you are continuously keeping an eye out for potential barriers and adjusting the treatment plan. Provide education, keep appointments, and aid in monitoring and managing adverse reactions. I pulled this quote from a WHO report. DOT succeeds for one pivotal reason. DOT makes the healthcare system, not the patient, responsible for achieving a cure. To emphasize the importance of the role you play as a DOT worker. Here is the last of the video, an introduction to DOT fieldwork.
Tuberculosis is caused by tiny germs that float in the air. If you're next to someone with TB and they happen to cough, sneeze, or even talk, it's possible that you could breathe some of the germs into your lungs. TB germs can live in a person's body without making them sick. This is called latent TB infection and needs to be treated in order to prevent the person from developing the disease. Approximately 1 out of every 10 people who are infected with TB develop TB disease. Symptoms include fever, general weakness, weight loss, chest pains, and a chronic cough. Directly observed therapy, DOT, requires a health professional to watch a TB patient swallow all of their medication. This leads to a reduction in treatment failure, relapse, and drug resistance. Personal safety is a critical element in successfully administering DOT. Establish a consistent meeting location with the TB patient. Examine the location for unusual street activities, escape routes, lighting, and places where people can conceal themselves, like trees, shrubs, and in alleyways. Wear comfortable but appropriate clothing. Do not wear glittering jewelry or high-heeled shoes. Carry a very small amount of money on your person and keep it in a wallet, not a purse. And make sure to have proper ID with you at all times. Directly observed therapy requires a commitment by the DOT worker as well as the patient. Finishing the entire treatment is absolutely necessary. As a DOT worker, you'll need to facilitate the treatment, avoid possible roadblocks, and empathize with your client. These are the building blocks, the tools, if you will, that you'll need to use in order to increase your chances for successful outcomes when administering DOT. Good luck!
Thank you.